Hello, this is Dr. Tom Groover from Boulder Chiropractic Clinic. I'd like to talk to you about baseline fitness. And baseline fitness to us is a level of strength and conditioning which enables a person to do all of their daily activities, whether they be work, home, housework, yard work, sports activities, and even a little more, like furniture moving or things that you need to get done without risking injury, without misaligning your joints. Now, when we talk about a joint misalignment, what we mean is what's often called in chiropractic a subluxation or subluxations. And that's the misalignment of a joint, which is less than a dislocation. Now, your joints are designed to function in a neutral position. They're designed so that the alignment of the joint is such that the way one bone meets with another one is just right. All right, there's a sweet spot there. It's kind of a Goldilocks situation where everything has to be just right. And if it's not, the joint will be weak, it'll get stiff, circulation will be impaired to the joint, it'll start aching, it can then start getting into more severe conditions of pain. And so to maintain the health of your joints, we recommend that you have a certain level of baseline fitness. So now, what determines the strength of a joint has to do with the structures that hold it together. So we have ligaments at the deepest level, and they control this to a large extent, but on top of that are muscles, and the muscles are much more influential in many ways, much more influential in their capacity to hold the joint in its neutral position. You'll have the mover muscles, which pull on the joint, and then you have the stabilizer muscles, which hold the joint in its alignment. So what we find is that a lot of times the ligaments are not strong enough to meet the demands placed upon them by our patients. And if that's the case, then you're going to have to do some kind of a conditioning program to keep the joints properly aligned while you increase the amount of load on your joints. So what happens is, as a joint is loaded up, it responds by getting stronger. So the ligaments are loaded up, they respond by getting stronger. The bones that are involved in the joint become stronger when you load up the joint. The tendons become stronger. Now, eventually your muscles become stronger. Simultaneously this occurs, but also what we need to know is that there's a certain priority that we have for building up this joint strength. We want to start by making sure the ligaments are strong enough to manage the load which muscles are providing them. So now your muscles can be much stronger than your ligament capacity to maintain the health of your joints. In such cases, we recommend that you start out with very low resistances, very low levels of loading on your joints, and gradually build up over time, because ligaments take time to get strong. Just like when you injure them, they take time to heal. In fact, there can be permanent injuries to ligaments because they just don't heal all that fast. So there's the ligament level, and then there's the muscle level. So your muscles, as I said, can override your joint's capacity to maintain its structural integrity. The joint can misalign or get subluxated, and then you have a problem. So the next thing is to get your muscles strong and to get them flexible and to establish what we call good neuromuscular control of your joints. Good neuromuscular control of your joints. So when that occurs, that means that the joint is healthy, there's no inhibitions of nerve supply to the joints, and they can function with strength and flexibility. The muscle tone can be balanced, and the person can be pain-free, move fluidly, move correctly, and enjoy themselves a lot. So this is something that I wanted you to hear because we find that people oftentimes will challenge themselves way beyond their capacity, way beyond the capacity for their joints to maintain their health. And this can happen when you move, like you're all of a sudden for 12 or sometimes 24 hours, you're carrying furniture and boxes and stuffing a van and all of that kind of stuff. And extreme sports activities where you're not properly conditioned, and then you go out and you run a marathon, or you do something like a 100-mile mountain bike race without training for it, things like that. So I hope this helps. And if you have any further questions about baseline fitness, let me know. And if you have something else you'd like me to talk about as well, please let me know about that. Thanks.